Welcome to our comprehensive guide on immunodeficiency. Today, we'll explore what immunodeficiency means, the difference between normal and severe forms, and why understanding this topic is crucial for health and well-being. Our immune system is our body's defense mechanism, protecting us from infections and diseases. When this system doesn't function properly, it can lead to immunodeficiency. In this video, we'll break down the basics, discuss key concepts, and provide real-life examples to help you grasp the essentials. Let's begin by understanding what immunodeficiency is and why it matters. Immunodeficiency refers to a condition where the immune system's ability to fight infectious disease and cancer is compromised or entirely absent. This can be due to genetic factors, environmental influences, or acquired conditions. People with immunodeficiency are more susceptible to infections, which can be frequent, severe, or unusually hard to treat. Understanding the underlying causes helps in managing and treating the condition effectively. Next, let's look at how the immune system normally works to protect us. Healthy immune system is a complex network of cells, tissues, and organs working together to defend the body. It recognizes harmful invaders like bacteria, viruses, and fungi, and mounts a response to eliminate them. White blood cells, antibodies, and other components play vital roles in this defense. When everything functions as it should, most infections are quickly controlled or prevented. But what happens when this system is compromised? Let's explore the different types of immunodeficiency. Immunodeficiency can be classified in two main categories: primary and secondary. Primary immunodeficiencies are usually inherited and present from birth, while secondary immunodeficiencies are acquired later in life due to factors like infections, medications, or chronic diseases. Both types can range from mild to severe, affecting how well the immune system can protect the body. Understanding these categories helps in identifying the underlying cause and choosing the right treatment. Primary immunodeficiency disorders are genetic and often diagnosed in childhood. These conditions result from defects in the immune system's development or function. There are over 400 types of primary immunodeficiencies, each affecting different parts of the immune response. Some people may experience frequent infections, while others might have autoimmune symptoms. Early diagnosis and treatment are essential to prevent complications and improve quality of life. Secondary immunodeficiency is acquired later in life and is more common than primary forms. Causes include infections like HIV, certain cancers, malnutrition, or medications such as chemotherapy or steroids. Unlike primary immunodeficiency, secondary forms are not inherited but developed due to external factors. Managing the underlying cause is crucial for improving immune function and reducing infection risk. Mild immunodeficiency may go unnoticed for years. People with mild forms often experience more frequent or longer-lasting colds and infections, but these are usually manageable with standard treatments. While quality of life may be affected, most daily activities can continue as normal. Regular medical checkups and prompt treatment of infections are important for maintaining health. Severe immunodeficiency is a serious condition where the immune system is almost entirely unable to defend the body. Individuals with severe forms are at risk for life-threatening infections, even from organisms that are harmless to most people. Hospitalization and specialized treatments are often required. Early diagnosis and aggressive management are key to improving outcomes and survival rates. Common symptoms of immunodeficiency include frequent infections, slow recovery, and unusual illnesses. Some may experience chronic diarrhea, skin rashes, or unexplained weight loss. Recognizing these signs early can lead to timely diagnosis and treatment. If you or someone you know has persistent or severe infections, it's important to consult a healthcare professional for evaluation. Diagnosis involves a thorough medical history, physical examination, and laboratory tests. Blood tests can measure immune cell counts and function, while genetic testing may identify inherited forms. Sometimes, doctors use imaging studies or biopsies to look for underlying causes. Accurate diagnosis is essential for choosing the right treatment and preventing complications. Treatment depends on the type and severity of immunodeficiency. Mild cases may only require prompt treatment of infections, while severe cases might need regular immunoglobulin infusions, antibiotics, or even bone marrow transplants. Managing underlying causes such as stopping immunosuppressive drugs or treating infections is also important. Personalized care plans help improve outcomes and quality of life. Living with immunodeficiency requires ongoing medical care and lifestyle adjustments. Regular doctor visits, vaccinations, and infection prevention strategies are essential. Many people lead full, active lives with the right support and treatment. Support groups and counseling can also help individuals and families cope with the challenges of chronic illness. Prevention is a key part of managing immunodeficiency. Simple steps like frequent handwashing, avoiding sick contacts, and staying up to date with vaccinations can make a big difference. In some cases, prophylactic antibiotics or antiviral medications are prescribed. Creating a safe environment at home and work helps reduce the risk of infections. Vaccinations are crucial for people with immunodeficiency, but not all vaccines are safe for everyone. Live vaccines may be risky for those with severe forms, so doctors carefully select which vaccines to use. Inactivated vaccines are generally safer and still provide important protection. Consulting with healthcare providers ensures the best vaccination plan for each individual. Good nutrition supports immune function. A balanced diet rich in vitamins, minerals, and protein helps the body fight infections. Malnutrition can worsen immunodeficiency, so working with a nutritionist may be beneficial. Supplements are sometimes recommended, but always under medical supervision to avoid complications. Genetics play a significant role in primary immunodeficiency. Family history can provide important clues for diagnosis. Genetic counseling is available for families with inherited forms, helping them understand risks and options for future children. Advances in genetic testing have improved early detection and personalized treatment strategies. Children with immunodeficiency may have frequent ear infections, pneumonia, or other illnesses. Growth and development can be affected if the condition is not managed properly. Pediatricians play a key role in early detection and treatment, ensuring children receive the care and support they need to thrive. Adults can develop immunodeficiency due to chronic diseases, medications, or lifestyle factors. Symptoms may be subtle and mistaken for other conditions. Regular health screenings and awareness of risk factors help in early identification and management. Adults with immunodeficiency can lead productive lives with proper care. As people age, the immune system naturally becomes less effective. Older adults are more susceptible to infections and may develop secondary immunodeficiency due to other health issues. Regular checkups, vaccinations, and healthy living are especially important for this group to maintain immune health. Some people with immunodeficiency also develop autoimmune diseases where the immune system attacks the body's own tissues. This overlap can complicate diagnosis and treatment. Managing both conditions requires a coordinated approach between specialists to ensure the best outcomes. People with immunodeficiency are prone to certain infections, such as pneumonia, sinusitis, and skin infections. Some may also experience fungal or viral infections that are rare in healthy individuals. Recognizing and treating these infections early is critical for preventing complications. Severe immunodeficiency often requires hospitalization, especially during serious infections. Hospitals provide specialized care, including intravenous antibiotics, isolation to prevent further infections, and close monitoring. Early intervention in a hospital setting can be life-saving for those with severe forms. For some severe primary immunodeficiencies, bone marrow transplantation offers a potential cure. This procedure replaces the defective immune system with healthy donor cells. It's a complex process with risks and benefits, but it can dramatically improve outcomes for selected patients. Immunoglobulin replacement therapy is a common treatment for many immunodeficiencies. It involves regular infusions of antibodies to help fight infections. This therapy can be given intravenously or under the skin and is tailored to each patient's needs. Some people with immunodeficiency take antibiotics regularly to prevent infections. This approach, called prophylaxis, helps reduce the frequency and severity of illnesses. Doctors carefully select antibiotics to minimize side effects and resistance. Many people with immunodeficiency also have other chronic illnesses such as diabetes or lung disease. Managing these conditions is important for overall health. Coordinated care between specialists ensures all aspects of health are addressed. Living with a chronic condition like immunodeficiency can affect mental health. Anxiety, depression, and stress are common. Access to counseling and support groups can make a big difference in coping and maintaining a positive outlook. Support from family and friends is invaluable for people with immunodeficiency. Loved ones can help with daily tasks, provide emotional support, and assist with medical care. Building a strong support network improves quality of life and helps manage challenges. People with immunodeficiency may need special accommodations at work or school, such as flexible schedules or remote options. Open communication with employers and educators ensures that needs are met and risks are minimized. With the right support, most people can continue their education or careers. Traveling with immunodeficiency requires extra planning. It's important to bring necessary medications, avoid high-risk destinations, and have a plan for medical care if needed. Consulting with a healthcare provider before travel ensures a safe and enjoyable trip. Being prepared for emergencies is essential for people with immunodeficiency. Keeping a list of medications, emergency contacts, and a plan for urgent care can save valuable time during a crisis. Family members should also be aware of the plan and know how to help. Ongoing research is improving our understanding of immunodeficiency. New treatments, gene therapies, and diagnostic tools are being developed. Staying informed about advances can help patients and families make the best decisions about care. Many organizations provide resources, education, and support for people with immunodeficiency. These groups offer information on the latest research, connect patients with specialists, and create communities for sharing experiences. Reaching out to these organizations can be a valuable step in managing the condition. There are many misconceptions about immunodeficiency. For example, not all forms are contagious, and having immunodeficiency does not mean someone is always sick. Understanding the facts helps reduce stigma and promotes better support for those affected. The COVID-19 pandemic has highlighted the challenges faced by people with immunodeficiency. Extra precautions such as mask wearing and social distancing are important. Vaccination and early treatment can help reduce risks, but ongoing vigilance is necessary. Let's look at a real-life example. Sarah, a young adult, experienced frequent sinus infections and fatigue. After medical evaluation, she was diagnosed with a mild immunodeficiency. With regular checkups and prompt treatment of infections, Sarah manages her condition well and leads an active life. Now, consider James, a child diagnosed with severe combined immunodeficiency (SCID) shortly after birth. He required hospitalization and eventually received a bone marrow transplant. With specialized care, James's health improved and he now enjoys a better quality of life. The outlook for people with immunodeficiency varies widely. With early diagnosis and proper management, many lead healthy, fulfilling lives. Advances in medicine continue to improve prognosis, especially for severe forms. Ongoing care and support are key to long-term health. Early detection of immunodeficiency can prevent serious complications. Regular health screenings, awareness of symptoms, and prompt medical attention make a big difference. Families and healthcare providers should work together to ensure timely diagnosis and treatment. The future of immunodeficiency care is promising. Research into gene therapy, personalized medicine, and new treatments is ongoing. As our understanding grows, more effective and targeted therapies will become available, offering hope for better outcomes. Patient advocacy plays a vital role in improving care for people with immunodeficiency. Advocates work to raise awareness, influence policy, and ensure access to treatments. Getting involved in advocacy efforts can help drive positive change for the community. Immunodeficiency affects people worldwide, but access to diagnosis and treatment varies by region. International organizations are working to improve care and raise awareness globally. Sharing knowledge and resources helps bridge gaps and improve outcomes everywhere. To summarize, immunodeficiency is a condition where the immune system's ability to fight infections is reduced. It can be mild or severe, inherited or acquired. Early detection, proper treatment, and ongoing support are essential for managing the condition and improving quality of life. Living with immunodeficiency can be challenging, but with advances in medicine and strong support systems, there is hope for a healthy and fulfilling life. Staying informed, working closely with healthcare providers, and connecting with others can make a big difference. Thank you for joining us on this journey through immunodeficiency. We hope this video has helped clarify the differences between normal and severe forms and provided useful information for those affected. Remember, knowledge and support are powerful tools in managing health. Stay proactive and take care.